So I've got a quick question for you. If your parent has a nurse coming to the house, who helps them shower, eat, or stay safe the rest of the week? If that question made you pause, stay with me with this video. This confusion happens all the time. I get calls all the time about this. Adult children come home after months, let's say, away. They notice changes. They know help is needed. But these two terms get mixed up. Home care and home health. Home. They sound similar, but they're not. By the end of this video, you'll know exactly what each one does, what insurance covers and what it doesn't, and which one families usually need first. So let's start with what families need but misunderstand. Home care is non-medical help in the home. This is help with daily life, not treatment. Home care helps with bathing, dressing, toileting, incontinence, meals and light housekeeping, medication reminders, companionship, supervision, and support for dementia and Alzheimer's care and other specific chronic diseases. Here's the key idea. If your parents struggle with everyday tasks of living, home care is the solution. No doctors, no nurses, just long-term consistent support. Now, this is where people usually interrupt and say, but my parents already have home health. I'm good. Well, now let's talk about that. Home health is medical care ordered usually by a doctor. This includes skilled nursing visits, physical, occupational, or speech therapy, wound care, injections, or IVs. Home health usually starts after a hospital stay, after a surgery, after rehab, or a fall, or a specific illness. Now, here's the most important part too. Home health is temporary. It's designed to treat a condition that stopped in the home. So if home health is medical and home care is daily support, here's the simplest way to remember the difference. Home health treats the condition. Home care supports the person. Or even more simpler, home health is part-time and short-term, no more than a few months usually. Home care, it's ongoing, it's daily. So if you remember nothing else, remember that from this video. This difference becomes obvious the moment adult children stay in the house. You'll see a nurse might come twice a week. A therapist might visit 1 or 2 times, 30 minutes each time. But the rest of the time, no one's there. No one's there to help with showers, prepare meals, prevent falls, watch for confusion. And that's when families realize, wait, medical care alone doesn't cover all the daily life things. And even when families understand this difference, I understand parents will often push back, not because they don't need the help, but because of what help represents. So the language matters as well. So if you need help, try this. Explain this to your parents. The nurse helps with your health. The caregiver helps with your day. Or this isn't about being sick. It's about staying at home longer with home care. When parents hear support, not loss of independence, resistance usually drops. So now the question becomes, what does my parent actually need right now? Now ask yourself, are daily tasks becoming unsafe for your parents if they can't do them? Is help needed when no medical staff is present in the home? Does support continue after home health ends? What happens? If yes to these questions, home care is likely missing in the home for your parents. Now, in many families, home health, of course, starts first. Home care fills the gap, and home care becomes the long-term solution. So if you're visiting your parents and feeling overwhelmed, that's normal. These terms confuse almost everyone. But once you understand the difference between home care and home health, decisions become much more clear and less emotional. Now, I want you to also remember, needing help at home doesn't mean failure. It means planning ahead. And planning ahead is how families keep parents safe, comfortable, and at home.